What actually is bronchitis? It starts with a cough. Maybe it feels dry at first. Then it turns into a deep, hacking cough that just won't quit. You feel tired, your chest aches, and breathing becomes harder. Is it just a cold or something more serious? Let's talk about bronchitis. What it is, how it spreads, and how to protect yourself. A brief history of bronchitis in the U.S. Bronchitis has been around for centuries, but it wasn't fully understood until the late 19th century. Early physicians described it as chronic lung inflammation caused by pollution, smoke, and infections. In the early 1900s, industrial workers were particularly affected due to poor air quality. Smoking became a major cause of chronic bronchitis, turning it into a serious health crisis by the mid-20th century. Now, we know bronchitis comes in two forms: acute bronchitis, a short-term infection often caused by viruses; chronic bronchitis, a long-term condition caused by smoking or long-term exposure to air pollution. What is bronchitis? Bronchitis is inflammation of the bronchi, the tubes that carry air to your lungs. When these airways become inflamed, they produce excess mucus, causing coughing and difficulty breathing. How does bronchitis spread? Most cases of acute bronchitis are caused by viruses, the same ones that cause colds and the flu. It spreads through airborne droplets, when someone coughs or sneezes, touching contaminated surfaces, then touching your face or mouth, close contact, sharing drinks, or being near someone who is sick. How bronchitis affects the body. When the virus enters the bronchi, it causes swelling and irritation, triggering your body's immune response. Your airways fill with mucus, and that's why you cough to clear out the mucus. Feel short of breath because less air can pass through swollen bronchi. Experience chest discomfort from constant coughing and inflammation. In chronic bronchitis, the inflammation never fully goes away, leading to long-term breathing issues. Signs and symptoms of bronchitis. So how do you know if you have bronchitis? Persistent cough, often producing mucus that's clear, yellow, or green. Chest discomfort, a tight or burning feeling in the chest. Shortness of breath, especially during physical activity. Fatigue, feeling extra tired from fighting the infection. Low-grade fever and chills, sometimes present. In acute bronchitis, symptoms usually last 10 to 14 days, but the cough may linger for weeks. When to see a doctor? Most cases of acute bronchitis go away on their own, but see a doctor if you experience cough lasting more than 3 weeks, high fever, above 101.3 degrees Fahrenheit or 38.5 degrees Celsius, wheezing or severe shortness of breath, coughing up blood chest pain that gets worse with breathing or coughing. If you have asthma, COPD, or a weakened immune system, you may need extra care to avoid serious complications. How to prevent bronchitis? Want to avoid bronchitis? Here's how. Wash your hands often to prevent viral infections. Avoid close contact with sick people. Quit smoking. Smoking damages your airways and increases your risk of chronic bronchitis. Wear a mask in polluted or smoky environments. Get your flu shot, since flu viruses can lead to bronchitis. Conclusion: bronchitis is common, but preventable. Bronchitis can be miserable, but with rest, hydration, and good care, most people recover quickly. Take care of your lungs, and they'll take care of you.